Today we will discuss a recently described soft tissue tumor entity. Our first case is a 57-year-old man who presented with a clinically suspected buttock cyst. The lesion was excised with clear margins. At low power, the specimen shows adipose tissue admixed with spindle cells set in a myxoid stroma separated by thick fibrous septa. At intermediate power, we appreciate the mixture of the adipocytic component and bland spindle cells with an abundant myxoid stroma. Note the rich capillary vascular network, a characteristic feature of this entity. At high power, the spindle cells are bland without cytologic atypia or mitotic activity. Again, the background shows prominent delicate vasculature. The adipocytic component also lacks atypia or mitosis and similarly contains the rich vasculature. Importantly, there are many lipoblasts showing bivacuolated cytoplasm and nuclear indentation. Let's summarize Case 1 morphology. A soft tissue neoplasm composed of an admixture of bland spindle cells, mature adipocytes, and lipoblasts within a variably myxoid, highly vascular stroma. It demonstrates overlapping but not identical features of lipoblastoma, myxoid liposarcoma, and spindle cell lipoma. Here's another case of the same entity. This case involves a 31-year-old female patient who presented with a vulvar mass. At low magnification, the tumor is lobulated and well circumscribed with thick fibrous septa. At intermediate magnification, we again see a richly vascular capillary network, mature adipocytes, and bland spindle cells in abundant stroma. At high power, the spindle cells remain bland without atypia, and lipoblasts are present. The morphology closely parallels that of the first case, a lobulated tumor composed of spindle cells, adipocytes, and lipoblasts within a myxoid vascular background. So, what is your diagnosis based on morphology? Immunohistochemistry, if performed, is generally non-contributory. CD34 is negative, RB expression is retained, and PLAG1 is negative. The diagnosis is lipoblastoma-like tumor. Lipoblastoma-like tumor is a relatively recently described entity. It most commonly arises in the vulva, inguinal region, and paratesticular area, but with increased recognition, cases have been reported in the limbs, pelvis, retroperitoneum, chest, and tongue. Patients range from 1 to 86 years old, and tumor size ranges from 1.8 to 30 centimeters. Clinical behavior is predominantly benign. Local recurrence is rare, and only a single reported case has metastasized. Pathologic features are characteristic. The tumor shows lobulated, circumscribed growth composed of bland spindle cells admixed with mature adipocytes and lipoblasts in a background of variably myxoid, richly vascular stroma. There is very low to absent mitotic activity. No necrosis is seen in all reported cases. As previously mentioned, immunohistochemical stains are not helpful. Loss of RB expression is seen in about 50% of cases, and the tumor cells can be positive for CD34, PLAG1, but are negative for DDIT3, MDM2, and CDK4. Molecular studies didn't find any consistent molecular changes, although immunohistochemistry show loss of RB expression in about half of these cases. There is no RB gene alteration. Additionally, there is no PLAG1, MDM2, or DDIT3 alteration, which helps distinguishing this entities from other morphologic mimickers. By lipoblastoma-like tumor, demonstrate mixed morphologic features of myxoid liposarcoma, spindle cell lipoma, apoblastoma, and atypical lipomatous tumor. Thus, differential diagnoses include these 4 benign and malignant lipomatous tumors. Myxoid liposarcoma shows similar myxoid stroma, delicate vasculature, and lipoblasts. At high power, myxoid liposarcoma contains tumor cells that are obviously malignant. The tumor cells are small round cells with fine chromatin and hyperchromasia. Mitotic activity is easy to identify, while the lipoblastoma-like tumor lacks both cytologic atypia and mitotic activity. Atypical lipomatous tumor, or well-differentiated liposarcoma, is characterized by the presence of hyperchromatic, atypical stromal cells easily recognized at low power. In addition, MDM2 gene amplification is a characteristic feature of this tumor. Lipoblastoma-like tumor does not exhibit nuclear atypia and does not harbor MDM2 gene amplification. Spindle cell lipoma is composed of spindle cells, mature adipose tissue, myxoid stroma, and ropey collagen. Unlike lipoblastoma-like tumor, spindle cell lipoma lacks the delicate capillary network. It shows RB loss by immunohistochemistry and molecular testing and is typically CD34 positive. Lipoblastoma is a benign neoplasm of childhood, very rarely affects adults. It shows overlapping morphology, including myxoid stroma, spindle cells, and lipoblasts. PLAG1 rearrangements support a diagnosis of lipoblastoma rather than lipoblastoma-like tumor. To wrap up, lipoblastoma-like tumor is a rare soft tissue neoplasm composed of bland spindle cells, mature adipocytes, and lipoblasts within a myxoid, highly vascular stroma. Although it demonstrates morphologic overlap with lipoblastoma, myxoid liposarcoma, and spindle cell lipoma, it remains a distinct entity. With awareness of its characteristic features, the diagnosis is usually straightforward.